Take it away, Jeff.
Good afternoon. This is Jeff Weinberg with Caregiver Champion, and it is my pleasure to introduce L. Bradley Schwartz, who is the president of his own organization that deals specifically with patient advocacy, which I have just recently joined. I found out about Bradley through a dear friend of mine and colleague who also is a very active patient advocate, and Anne Lewin, who we actually interviewed several weeks ago. So thank you.
More than a patient advocate, Anne's a guru. She's like she's the master.
Well, you're exactly right, and I feel honored to actually know her. I really do. She's the heart and soul of everything that we try to do for people. So that's a very good point.
Yeah.
So without further ado, I'm going to pass this on to Rachel, and we'll get started.
Great. Well, we're so happy to have you. Thank you, Bradley. Tell us a little bit about your background. Are you coming from Chicago today to talk with us?
I am, yes.
Great. So tell us about your background as in the patient advocate world.
Well, I mean, my background is legal. I was a lawyer. Well, I am a lawyer, and I've been practicing law for, I don't know, since 91. Do the math. I'm not good at it. It's got to be 25, something like that.
29.
But I was 29?
Yeah.
Wow. All right. So, and I was a litigation trial attorney. I used to go to court and beat up doctors all the time and just fight with them. I'm not kidding. That really was my job, was to go fight injury claims and just go at it. But in 2004, I was 37 years old. I ended up going to the hospital because I wasn't feeling good. I had a really bad headache, and the headache was just kept getting worse. I started feeling a little bit lethargic. It was Mother's Day, and it was also my wife's birthday. It was May 8th of 2004, and Mother's Day and my wife's birthday fell on the same day. So I was kind of not being looked upon as a good person, that day, because I was laying around and I wasn't feeling good. Mm-hmm. My wife said to me, well, if you don't feel good, why don't you go to the hospital? So we go to the hospital, we take an ambulance. And I just have to say that it was the worst headache. No 37-yeyear-old man is going to go to the hospital because they have a headache on their wife's birthday.
That's for sure.
And that's important to note, because I think it just really speaks to everything that got me involved with advocacy, because you're judged, by how you first come in the door, and it doesn't often change. I went in to the hospital. All the good doctors and all the good nurses had decided that they probably wanted to spend time with their mother on Mother's Day. So I got kind of a second string staff that was made up of a ragtag team of moonlighters and just people working overtime. And you could tell it was a beautiful, glorious afternoon, like low 70s. It was a beautiful spring day. Nobody that was in the hospital that day looked like they wanted to be there. Mm. And when I went into the room, they took my vitals, they checked me out, but then there were a couple of shift changes and nothing really happened. They didn't realize that I had meningitis. They didn't realize that I was going septic right in front of their eyes. They didn't realize that the lab reports, when they took the initial blood, the lab reports came back in a timely manner. They showed that there were panic levels at every single element of the blood count. The white blood count was through the roof. The platelets were just, it dropped so low that I don't know if, it requires a little knowledge of medicine, but it was past the point of that I could even get a spinal tap because my platelet count was so low. They thought I would bleed out. But anyway, before you know it, 8 hours later, without any meaningful care whatsoever, I get dumped off in the ICU, and I wake up a month later, and the doctors and nurses, everybody tells me I'm lucky to be alive when I woke up. They didn't tell
Wow.
me that they had ignored all these warning signs. They didn't tell me that they ignored me because they just felt like I maybe I was hungover. Nobody listened. I had 5, 6, 7 friends and family members with me in the emergency room for that 8-hour period of time. And every single one of us are pretty much trying to get the attention of the doctors and nurses to do something. And I bring up the fact that I was a courtroom lawyer for the fact just to demonstrate that I wasn't really a shy person. I was the kind of person that would speak up for myself. I came from a family of people that would speak up. Nobody was sitting around there just saying, oh boy, let's just hope he gets better. No, we were trying to get the doctors and nurses' attention at the hospital for about 8 hours, and nothing was done. So here I am. I don't know if you could tell, I'm missing 2 hands, and I'm missing 2 legs.
Oh my.
And this is all because I wasn't cared for at the hospital about 16 years ago.
Wow.
As it turns out, if they would have listened to me, they would have read the lab reports, which they conceitedly just completely, they came in during a shift change and nobody saw them, and the computer system was new, and it was the perfect storm where everything that could have gone wrong did go wrong. So I go to rehab. I get back and fitted with the prosthetics. I go back to work as a lawyer, and I figure, okay, well, now's a really good opportunity for me to try and change things for people. I've been through this. There's a lot of other people out there who have had horrific experiences with the medical field. So I become a malpractice lawyer, and the phone rings off the hook because people want to talk to a guy that's been through it. You know, I was able to distinguish myself from a lot of other lawyers out there who just, you know, they don't have the compassion. So anyway, I was able to draw these people in. But it turns out that, and this is something I probably should have known, and I did know, but 99 times out of 100, when somebody is calling a lawyer because they think they have a medical malpractice case, they're really just having a problem with their doctor. There's a communication problem. It's so hard to file a medical malpractice suit. Every state is different. The barriers are incredible, and especially just talking about the day and age that we live in, it doesn't really change too much over time. But right now, doctors are heroes, and you know they have. It just creates an extra burden. So I start hearing all the stories. In none of the cases, and the complaints that I'm getting are really amounting to medical malpractice, but they're all horrible, horrible, horrible problems in the medical community, in the hospital, institutional community. And I don't know what to do. You know, I'm like, what do I do? You say, after you start saying to people, I'm sorry, I can't help you. This is not a legal case. I start asking all my lawyer friends who are doing this sort of thing. I'm like, what do you do? I don't know. We just tell them we don't have a case. So that sucks. Because here I am thinking that this horrible thing happened to me, and now I'm going to be able to turn it around and help people, but I'm not able to because they're not a case. What do you do? So I switch it and I say, you know what? Maybe the way to do this is to try and avoid the harm from occurring in the first place. Goes contrary to everything that a lawyer does. Lawyers make money when they are bad cases. The worse the injury, that's the old horrible saying that if you hit somebody in the car and they're writhing on the road, back up and make sure you take them out, because it's a horrible fact of reality that lawyers make money based on how horrific the injury is.
Wow, I just have to say, what an incredible story. And there's probably no better patient advocate than someone who has gone through all that you have. That's pretty powerful, and I just commend you for using that to help and serve others. That's really amazing.
And I wanted to add that, first of all, it's a horrific story, and I'm really sorry to have that happen to you. I also, as you're speaking, a colleague who actually works with me as a patient advocate had something similar just happen to her. She had back pain, and she went to the emergency room. The emergency room did no testing and gave her a script to see an orthopedic doctor. She went to see the orthopedic doctor, and the doctor wrote a script for therapy.
Mm-hmm.
That weekend, she went away to visit her daughter, and the next thing she knows, she's walking into a closet, which she thought she was the bathroom, and she ended up septic, and literally it affected her heart, her kidneys, and her neck. Fortunately, it was caught soon enough that after 4 months, she's now recovered.
Mm-hmm.
But it's a terrible, terrible
Horrible.
situation.
Yeah. Uh, Um, you answered really a lot of questions as to what I was going to ask next, which is why you became a patient advocate. But something else that we'd like to know about is about your organization, Greater National Advocates, and what you do there and why you created it.
Okay, so I'll just pick up where I left off. I think it's a good
Right.
tie-in, because what I started to do is exploring, trying to find a way to help the people that, you know, I thought I was going to be able to help, but I wasn't able to. So I do a little bit of research, and, you know, I find out that this is back in probably around 2008 or 2009, when there is a small group of people all over the country that are made up of, you know, former nurses and social workers that have left the practice, and they're calling themselves patient advocates, patient navigators, healthcare advocates. I decided I needed to get involved and figure out what it's all about. I do a little bit of traveling. I go meet some people. I meet people like Anne, and I get inspired. And I got involved in the organization, served on boards, became a member of NAHAC, National Association of Healthcare Advocacy Consultants. I served on the board for a little while on the PAC board. And, you know, one of the things, it just became clear that everybody out there is doing a really good job of what they're doing. For example, we're going to talk about AFA. That was on the list, right? I think one of the questions is, what's the difference? And, you know, when it comes to AFA, I just need to be blunt, that I don't think anybody would be here if it weren't for AFA, and if it wasn't for what, you know, Tricia has done over the years that kind of cultivate this industry and give people the tools that they need to actually feel confident and succeed in a brand new area of practice. So the advocates are out there. The problem that I've discovered, and the problem that I kept hearing about serving, you know, on the boards and everything, is it's all fine and good that we're doing what we're doing, but nobody out there that needs us has any idea that we exist. So I partnered up with a friend of mine, a very dear friend of mine that I've known since pretty much junior high, and he's in marketing and graphic design. He's out in California. He's worked for, you know, big corporate Fortune 500 companies, rolling out major campaigns for Motorola, Coca-Cola, things like that. He said, you know, we could do this. So we just made it our mission to try and like recognize what everybody else has done out there and try and identify the prong that's missing. And the prong I think that is missing is public awareness, and letting people know that the advocates exist, and making it easy for a patient or a loved one who's in crisis to actually just do a quick search, learn about it real quick, and find somebody. So that's, I think, what differentiates, you know, Greater National Advocates from the other organizations. We're not doing the training. We're not doing any certification or credentialing. I think there are great people that are doing that, and kind of what we're doing is pivoting from that and saying, well, everybody's doing a great job with all these other things. Let me concentrate on what I know I can do. I'm going to level with you guys. I'm fortunate enough to have suffered, you know, a horrific medical error that I was able to recover. I had a lawsuit myself, you know, so I'm kind of sinking my money into this. I'm self-funding a national not-for-profit organization designed to just get awareness to the public about patient advocates and give them a central location where they can get the help they need. And that's,
Well, I want to interject something. The awareness is so important, and the industry is still relatively new, although, like you said, it's been around for a while. But every time I tell somebody what I do, I say, well, why weren't you available 3 months ago?
Hmm.
That's
And I was like, um,
Right.
I was available 3 months ago, but you just didn't know about me.
right,
Right.
Uh,
right.
so you're being able to publicize and be proactive in terms of what patient advocates do is so important, Bradley.
Thank you. It's
Yeah,
important. It's important for everybody. I mean, it really has. It's all I do. It's all I do every day. Is try and improve the awareness and the availability of patient advocates, which
And
brings up the fact that caregivers are patient advocates. Just like the public doesn't know that patient advocates exist, a good portion of the people that are already practicing patient advocacy don't know that they are already advocates. And I'd
I
love
want
to
to
include them.
I want to take a step back for a second because I want to add something to the patient advocate piece. So when you deal with hospitals and you deal with doctors and when you deal with retirement communities, lots of times patient advocates are viewed as attorneys. And I try to explain to them that that's not the case. And in fact, I'm here to partner with you so that we can do what's best for the client.
Mhm.
But I've had, it is growing because the people are now knowing what a patient have, and I'm talking about like hospitals and doctors and things like that.
Well, yeah, because actions speak louder than words. And if they see what you could do, they don't care about your title.
Well, that's true, but they first have to be open to wanting to see what I could do.
Right.
Okay, thank you. So you were saying about caregivers.
Well, that is the topic, I guess. And, that's the crossover. Yes. I mean, caregivers work hand in hand with patient advocates. Advocates work hand in hand with caregivers. Family work hand in hand with both. Both have different skills that, you know, you know, I just, when somebody's taking care of somebody and you're doing it for an extended period of time, you get exposed to every single element of 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 what it takes to keep somebody well and happy and engaged. And I've seen it, from a personal standpoint, you know, being the receiving care for years. I still do. My wife, I consider, she unfortunately is a caregiver because there are just certain things that she just has to do for me. I've done it with family members. I've seen it across the board. I've witnessed what I've been preaching, the transitions from from hospitals into subacute facilities, the transitions to home, what it takes to take care of somebody at home, the emotional toll on the caregiver themselves. That's why, you know, part of the goal of Greater National Advocates is to try and get away from what's happened in medicine, which is that everything is kind of separated from everything else. You need a referral here, you need a specialist for this. These are people that are just good at walking people through problems and getting things done, and they have the time and the resources and the heart to do it. So just from my perspective, I just don't I see patient advocacy and caregiving as side by side, hand in hand, almost one and the same, with different
I
levels of expertise, depending on experience, of course, different levels of ability. But I think that the sky is the limit.
I totally agree with you. Are you familiar with the book called Hospital Warrior by Bonnie Friedman?
No, actually, I wish I was.
Okay, well, I'll connect the two of you. She actually is sister of a dear friend of mine, and she was in and out of the hospital with her husband. I'm not sure. I think it's like 19 times. And during that time, she obviously acted as her husband's caregiver advocate, and then she wrote a book about it.
Mhm.
And she very much fits the bill that you're talking about.
Yep.
The other thing I wanted to ask you about, which I've been looking into with greater detail, is what have you worked or done anything with the caregiver who is the working caregiver and it has a full-time job and
I,
anything like
I mean, most caregivers are struggling many different things. I mean, if you don't have a full-time job, you're still juggling caring for yourself and caring for your family with taking care of somebody else. Whether or not you have a full-time job is almost irrelevant because it's just a different mechanism of the routine. Instead of waking up and going to work and going to your job, and you're going to do it differently, but you're still taking care of somebody else. You're still putting somebody else before yourself. So of course, working caregiver. I think everybody is a working caregiver.
the reason why I'm talking about it from an employee perspective is that there's been studies done now that are saying that 20% of the workforce, at least, are working full-time caregivers, and that those people are stressed to the max, and they're not getting any help or relief anywhere.
Mm-hmm.
So it becomes very important uh, that they also get extra help.
Yeah.
And then I'm sorry.
So,
The last thing I wanted to say is that the reason why I changed my company's name from Senior Assistants to Caregiver Champion, and the reason why I changed it was because the caregivers in many ways need more help than the person who they're trying to help. And stress is like to the max.
yep. Well, I think the way to get that change and to get that help is through almost like unionization or just sheer numbers and being able to lobby effectively for the help that you need. And that help is going to have to really come from the employer. That's the first place it needs to come from, when the employer recognizes the fact that 20% of their workforce is actually taking care of somebody else, and it comes, productivity and, employee well-being comes into play. And that is just a huge goal of mine. I can't say that it's always been the goal of mine from a caregiver perspective to get the support of employers, but it is definitely something that has been on my mind over the last few months. I've been concentrating on the patient advocacy part of it and trying to get employers to understand that they should be paying for patient advocates, because the number one problem that you hear about in patient advocacy is that nobody knows what we are or nobody knows what we do. The second biggest complaint is, how do we get paid? So I think that the two go hand in hand, and that's kind of why I started the national network, to try and gain numbers and gain the momentum to demonstrate that there's a national force to be reckoned with. And if we can get this going in every single state and get thousands and thousands of advocates out there that are practicing listed, then I think, and I would definitely undertake that challenge of taking the Greater National Advocates Army, so to speak, to the footsteps of employers and say, hey, look, we've got all these people here that they should be included in your employee assistance programs. You should be paying them because they're going to be keeping your employees happy. They're going to be keeping your employees more productive. So it's one of my goals.
It actually costs the employer twice as much money because of what's going on with their employee.
Right.
Well, is there a way that I can enlist in your army?
You're already listed.
You are
Oh, okay.
directory.
You've been there. You're an early adopter. You've been in there for a little bit. See, here's another problem. Half the people that don't even know that they're even being promoted out there. So I got to pull everybody together. We got to get on board. I got to tell you, Greater National Advocates has been live for probably about 3 months right now. It's been incredible. I'll tell you one thing you could do, one thing everybody could do that really helps spread the word is, writing articles and writing blogs. We've already gotten, I think, 62 in just a few short months. We're pushing them all over the place to try and get, look, it's one thing to go out there and say, hey, join our organization or become an advocate. People don't like the direct sell, If you can give them some information that is enlightening and it actually helps them, they're going to click on it, they're going to read it, and it's going to bring them back to the site, and then they're going to learn, and then they're going to join. Yeah. It's just something that I've found. You can tell somebody all day, oh, it's like, listen to this song, you're going to love this great song, but they're not going to listen to it. They're going to hear it on the radio on their own, and then they're going to like it. They want it. People like to discover things on their own.
Absolutely. And that's one of the reasons why we wanted to create this Q&A, was just to be a resource of information, to bring people together and bring awareness to these conversations. And we were actually going to submit one of Jeff's pieces to your blog. This kind of segues into our next question about some of the challenges with COVID-19 that caregivers and patient advocates are facing. I was wondering what your experience or what has been your concern for this industry during COVID.
Well, I'm just going to say that I really think that the COVID scenario is going to change society in a lot of different ways. Look at us here now doing what we're doing, technically deficient people here being able to manage intimate conversation.
You're right.
And this is the sort of thing that's happening all over the place. I mean,
right.
Advocates have been brought together more during COVID than they ever were, because of the sharing of resources and the sharing of stories and the use of the technology. Because of COVID, there have not been a lot of the elective type procedures that you see. So, there hasn't been a big, it's kind of slowed down a little bit in terms of the daily hand-holding and the accompanying patients to doctor's appointments and things like that, just over the last couple of months because of COVID. However, I will say that, it's provided an incredible opportunity for hospital administration, hospital social workers, and discharge planners to really understand what patient advocates can do, because they're willing to accept the help right now. We're in uncharted territory. Everybody is doing the best that they can. In a lot of states, there are executive orders that have almost put a moratorium on medical malpractice during COVID-19 in order to let the the medical professionals not have to worry about getting sued if they do something wrong. So I just have to say, I really think it's kind of let the guard down a little bit, and it kind of goes, it ties into what you were saying earlier about the fact that you don't want to be viewed as a lawyer. You don't want to be viewed in an adversarial role when you're trying to help somebody. And I think that by virtue of the fact that the fear of liability, especially during COVID, has opened up dialogue between advocates and hospital administration, for example. They're not scared like they used to be. They have nothing to fear. And I've witnessed it firsthand. I mean, I've got a handful of cases where we're just working with the upper echelons of hospital administration, trying to make smooth transitions and keep people safe and navigate all of the rules and the visitation and everything that goes along with this pandemic. So it's forced everybody to hunker down, come to terms with what's real important. And I really think that it's going to benefit advocacy in the long run. And, it's given us a lot of opportunity to focus on promoting what we do while we're not in the hospitals, holding patients' hands and doing that sort of thing.
Right.
So
that's a great perspective.
I really think so.
Here. Jeff, did you want to add something?
I just wanted to say that currently I have one person in the hospital, and 2 other people in nursing homes and 1 in a personal care home. And I have found that exactly what you said, people are much more willing to work with me. And it is much more of a partnership. And I appreciate that, because that's all we want to do is
Yeah.
work towards the best interest of our clients.
Yeah.
Absolutely, and it takes everybody coming together and being aware to do that.
Mhm.
We're coming close to the end of our time here with this, so I just want to make sure that we thank you, Bradley, so much for your time and sharing your knowledge and your story and everything here today. And we'd like to tell people where they can find more about you, where they can find more about Greater National Advocates, and then if there's any links or resources that you have found helpful on your journey that you'd like to share, please send those to us, and we'll put those in the comments of this video so people can be directed to some more helpful info.
Sure will. Well, I'll just tell you that it's real easy to find Greater National Advocates. It's gnanow.org. And it's a patient-facing site right now. In other words, if you go to greaternationaladvocates.org, it's not going to be like going to one of the other advocacy sites out there that are pretty much geared toward the advocate community, B2B, business to business. No, this is geared toward patients and families, and the messaging is geared toward them. If you go to gnanow.org and you want to join, go on the upper right and click the button that says advocates, and that's going to give you all the back end information for you to learn about how to become a patient advocate. But the first front facing part of the site is all geared toward patients and families. We have instructional videos that we spent a lot of time with.
So anybody can join, Bradley?
Yeah, you know what? I mean,
That are taking care of someone?
if you're a caregiver and if you have experience, of course you can join. You absolutely can join. You don't need to be a board certified patient advocate in order to be an advocate. You don't need to have a PhD or 10, PhDs and masters in, public health in order to be a patient advocate.
Just want to let you know, in case we get cut off, there's less than a minute and it's going to close down. So
Well, I want to thank you, and I hope that you'll post this once we send it to you to your. Okay.
yeah,
It's a pleasure. I've learned a lot from you, Bradley, just by doing this. So I'm looking forward to being able to work together more frequently.
Sounds good.
absolutely. We'll continue the conversation outside of Zoom here.
Thank you.
Thanks for your time, Bradley.